Okay, here we go.
Okay. So welcome to our grand round. It's been about a year since we've had one, thanks to COVID and lots of things. It's a bit of a different day today, really, because normally I would be stood at the front of the lecture theatre introducing the speakers. But obviously, during COVID, we've had to access IT and information technology in a very different way. So this is our first grand round that we're doing using the Teams environment. Feedback from everybody would be much appreciated. Please bear with us if there are some technical glitches, but hopefully as we go through the day, things will go not hopefully as smoothly as could possibly be expected. It gives me great pleasure to introduce our speakers today. Edgehill University is a university literally on our doorstep of our Ormskirk site, and they took their first intake of MBChB students in September of this year. Now, I've heard lots of things said about the Edgehill Medical School course, some of which have been founded, some of which I think are sort of based on rumour mongering. I think the advantage that Edgehill University have had is that they've been able to develop a medical school curriculum from scratch to equip our doctors for what their working lives are going to be. As somebody who will be hitting their 30th anniversary as a doctor this summer, it has given me an opportunity for reflection on how my role has changed fairly significantly over those 30 years. And if the changes that I have had have been significant, I'm sure that the changes for our colleagues in the future are significant. And that means we need to support and equip our colleagues of the future with the skill set that they need. Health demographics are very different now than they were when I qualified in 1991. And I think our medical school curricula have to change and adapt in order to reflect them. And Edgehill are very much at the forefront of that with their new course. And so it gives me great pleasure to hand over to Paola and Clare to talk about their curriculum and how they have developed it.
Okay, thanks very much, Anne. Let's introduce ourselves to start with. So my name's Clare Austin. I'm Director of the Medical School here at Edgehill.
I'm Paola Day, Professor of Public Health and Epidemiology and Head of Undergraduate Medicine.
So we're in the same room, but obviously we're socially distancing. So you will see Paola in the second part of the presentation. So I'm just going to start by giving a very brief overview of the medical school, how it came into being and where it kind of sits in the broader university context. And then I'm going to hand over to Paola, who's going to give some more information about our programmes, and in particular the MBChB. Okay, so I thought it might just be worth giving a very brief background to Edgehill University. I think many of you will be aware it is a relatively new university. It only was awarded degree awarding powers in 2006, but by 2014-15 it had received the accolade of Times Higher University of the Year. So, you know, I think it's a university that is developing, that is evolving, that is responding to the external environment and the changing needs which Anne's alluded to, in particular with respect to medicine. It's got a long history of excellence in teaching, and in universities, teaching excellence is governed by something called the TEF, the Teaching Excellence Framework, and we were delighted to be awarded gold in the first ever TEF. We have a developing research profile. I haven't included it here, but we've just submitted a very much stronger submission for the corresponding research excellence framework. As a university, it has a long history of widening participation, so providing opportunities for students from less advantaged backgrounds to enter higher education. a very significant proportion of its students come from the local regions, around 80% in fact. And I just ask you to bear those facts in mind when we come further along the presentation, because they are of relevance to the medical school and our ethos. Okay, so the Edgehill University Medical School, it is a new medical school, and we were officially formed in 2019. And we're actually one of 5 new medical schools who were awarded funding as part of the government's Undergraduate Medical Training Expansion Programme. That provided significant numbers of additional undergraduate medical training programmes, some which were given to existing medical schools, but there was also an opportunity for new providers to bid for places. And just for clarity, undergraduate medical school placement numbers for home students are very tightly controlled. Obviously they map to workforce needs, but it's also because of the high cost of tariff. There is another route, and that's the one of a private medical school, which a small number of providers are starting going down. But really this government funded undergraduate medicine programme that absolutely matches onto medical needs is what we wanted to aspire to. So we were delighted, as I say, that we were one of 5 new medical schools awarded funding as part of this programme. We're actually only one of 3 freestanding medical schools and the only one in the Northwest. So it's a fantastic opportunity for us to do something that's slightly different and that's complementary to the other provision that exists both locally and nationally. And whilst we're a new medical school, we've actually got more than 20 years experience of medical education. As I'm sure many of you are aware, we have a really well-established suite of programmes in postgraduate medical education. We've held commissions from Health Education England for many, many years now to deliver modular postgraduate medical education and leadership training to trainees. And we run a rapidly increasing Masters of Surgery, Masters of Medicine programme, which many of you might be involved in. So we weren't completely new to medical education when the opportunity came to bid for an undergraduate medicine programme. And as a medical school, we're very much embedded within the broader faculty of health, social care and medicine. And within the faculty, we run a wide range of educational programmes in nursing, in midwifery, in social work, in nutrition, in health and wellbeing, and a broad suite in kind of mental health support. And I think that's important in our ethos as well, which we'll come to later in the programme. We're very much embedded within a school that trains a multi-professional workforce with a particular focus and a particular growing focus on new and evolving roles. Okay, so the government, the opportunity to bid for these undergraduate medical school places was very much governed by government priorities. And they are, in brief, set out on this slide. Firstly, any new school, any new programme needed to meet future workforce needs. And it needed to support, in particular, shortage specialties. It needed to provide high quality training and placements, and there was a particular focus on widening participation to medicine. So in terms of meeting future workforce needs, when we looked at the workforce needs of the local region, despite the fact that there are a number of medical schools, as you'll be aware already in the northwest of England, there are significant workforce challenges, and that obviously extends to the medical workforce. Shortage specialties, in particular, general practice, primary care, psychiatry, mental health. High quality training and placements, I think, speaks for itself. And widening participation to medicine, as I've already said, as a university, we have a long history of supporting widening access to higher education. So all those things were considered when we started thinking about both developing our bid, but also developing the ethos and vision for our medical school, and in particular our MBChB undergraduate medicine programme. So how did we say, and how will we address government priorities? Well, Paola will talk about this in a lot more detail, but basically we want to make sure that our curriculum is embedded in and for our local communities. We want to provide our students with early and greater community, primary care and mental health experience. We want to make sure that we have significant involvement of service users and carers, providers and commissioners, both in the development of the programme, the evaluation of the programme, and obviously in the delivery of that programme. And that's very important to us, in particular, you know, the relationship with local providers such as yourselves. We are actually the only new medical school to be developing its own curriculum, and whilst clearly it needs to meet the GMC outcomes for graduates, it does allow us to do something that's slightly differently and very much forward focus. And so we've tried to make sure that there's a real emphasis on team working, new roles, new models of care, leadership and resilience, all of which are of key importance in the medical workforce of today, tomorrow and the future. And in particular, we wanted to attract local students, including those from disadvantaged backgrounds, who understand the needs of the local communities and who will hopefully want to stay and work here post-graduation. Just say a little bit about widening participation. So around 70% of medical students are from the more advantaged backgrounds or more advantaged geographical areas. And, you know, I think it's becoming acutely apparent that we need a medical workforce which is representative of its population. And to address this, we have two major initiatives. Firstly, we have a widening access to medicine programme that's a two-year outreach programme to support local students from less advantaged / disadvantaged backgrounds to both apply for an undergraduate medical place and to support them through the process of selection and interview. And we also have a foundation year for medicine, which is purely for, again, students who achieve well academically, but are from less advantaged regions of the Northwest. That's a one-year programme, and essentially it's a year zero programme. And our students who successfully complete that year progress onto our 5-year MBChB. I know Paola's going to talk a little more about our entry requirements and the composition of that programme. So widening participation into medicine is absolutely key to us, and it fits very well within the ethos and background which Edgehill has in supporting students from those backgrounds. So just a few practical things, just to let you know where we're up to in the development of our undergraduate medicine programme. So as you'll be aware, all new medical schools or all new undergraduate medicine programmes need to have Gmc approval. And that's an 8-stage process. And schools can't actually complete it until their first cohort of students has finished the whole of the programme. We're actually at stage 7, which is really a rolling stage, which lasts until we get that stage 8 approval. To support us through this approval process, all new medical schools need a contingency medical school, and the University of Liverpool have kindly agreed to act in this capacity for us. And we think this is a big positive because we work very closely together on things like placements to make sure that we're not competing for placements, but there are enough for all our students to have an excellent experience. We are small. We asked for 30 students a year and we were awarded 30 students a year. And we wanted to start small because we know it's no mean feat developing an undergraduate medicine programme. We want to do it as well as we possibly can do, and we want to support our students as well as we possibly can do. So we're small. As I said, we are developing our new curriculum, which Paola will say more about, and as Anne said, we accepted our first cohort of MBChB students at the end of last year. So I think that this is our ethos really, that the Edgehill Medical School would develop a new generation of doctors who understand the needs of the local communities and who can respond to and drive forward new models of care. And I think it's just important to highlight that the medical school isn't just about the MBChB. You know, what we want to do is raise aspiration and support application for medicine even before that sixth form stage by outreach, and we've already started involving some of our students in that, by developing a new and innovative MBChB curriculum, and by providing a wide range of postgraduate medical education and indeed multi-professional education, including new roles. And so the medical school has a kind of continuum right from school to continuous professional development. Okay, so that's a bit of background. At that point, I'm going to hand over to Paola, who's going to provide some more detail about our undergraduate programmes. Okay.
Afternoon. Nice to meet with you, even if it is virtually. Okay, so just to, some of this we've already covered, but our two programmes are a 5-year programme, which we call our direct entry, and a 6-year programme, which includes a year 0, which we call foundation year, and students then go on to the 5-year programme. The entry criteria pretty much similar for the two, apart from the A-level grades that need to be achieved. For the direct entry, this is 3 A's, and for our 6-year, it's 3 B's. The 6-year have to actually meet certain widening participation criteria and to be living resident within the northwest of England. The selection is pretty much the same as well. We set UCAS thresholds, slightly different for the two programmes depending on the number of applicants, but they all go through multiple mini interviews, and we make our decisions after that. Obviously with COVID we haven't been able to run that as we would normally face to face, but we've had a 2-stage process, and we include service users and clinicians in those interviews as assessors. Just a bit of an overview of the student journey here, but to emphasise that our curriculum is a spiral curriculum. We have year-long modules rather than individual modules within year. We have core cross-cutting themes. And we are very much supporting our students with not just well-being and support, but also considerable amount of assessment support between transitions from years, particularly between year 2 and year 3, where the students get to start going on to a more placement-driven curriculum. And also from the very beginning, we start students with career support, and our students have actually set up their own careers society, I've got the words, Career Society, and we also have career champions who are clinicians in specific disciplines to support our students if they're particularly interested in an area. Just to highlight a little bit about what the foundation programme includes, we wanted to very much not just repeat A-levels, and we also had to be mindful that we didn't want to actually just do a year one, so that by the time students get onto year one, they were bored or disinterested or lacked engagement because they'd already covered the subject areas. So we've taken it very much from a public health perspective in terms of the topics that we look at. So they do healthy lifestyles, which focus on physical activity, environment and health, at the moment's climate change, children and adolescents they've been doing about knife crime, frailty and ageing, maternal health to represent global health. And we also then have an inequalities theme, which brings together a lot of the issues that they have been considering. And as we know, inequalities is a huge, health inequalities is a huge issue within the northwest of England. Cross-cutting that then, they do sciences for medicine, they look at clinical perspectives, clinical communication, health systems and public health, and they have both personal and professional development as well as academic development in terms of study skills. And really the aim is to build their confidence, their self-esteem, as well as their knowledge and their understanding of medicine. And a lot of these students haven't had the same opportunities for understanding what medicine is about. They haven't had that communication and support from friends or family who are already in the medical profession. So we also give them 2 experiences, week-long experiences, one in primary care and one within an NHS trust. Students, if they pass all their assessments in the foundation year, will automatically transfer to our 5-year programme. So that's why it's really important that the selection process is the same for both programmes. As in many traditional programmes, we divide our 5-year programme into 2 years, our phase 1, which is mainly campus-based and is mainly biomedical sciences, but I'll tell you a little bit about what we also do in those in phase 1, and then phase 2, 3 years, which is mainly on clinical placements with some consolidation within the university. Across our 5 years of the programme, we have named the years so that the focus of the years is on certain aspects. So in year 1, it's about understanding the person and the community. Then it's understanding about healthcare, where and when people receive healthcare. Our year 3 focuses on multidisciplinary teams. Year 4 is around the patient journey from primary care to secondary care, tertiary, and then back again. And our year 5 focuses on preparing students for practice. And as I said before, it's a spiral curriculum, and that is really so that we can take these threads of biomedical and social sciences in the early years, take that through to application for disease and on to treatment and management. So this is an example. Nutrition is an important GMC outcome, learning outcome. And so you can see here how we focus in year 1 on nutrition in normal health, nutrition and public health. We've been hoping to do that in collaboration with our nutrition team and some interprofessional learning with our nutrition students. COVID has put a little bit of a barrier on that for this year, but in future years we'll be able to do that. Then we can go into year 2 about impact of nutrition on disease, and then as we get into year 3 and 4 and 5, we could look at more nutritional assessment, impact of disease on nutrition, and also the treatment and management. So a little bit more about phase 1. It's divided into the 7 body systems. So we have to reflect in our curriculum a lot of what University of Liverpool is doing, so our students, if there is an issue, could pass their assessments and be transferred to University of Liverpool. So we have 7 body systems for years 1 and years 2. Year 1 mainly focusing on normal variation, introduction to clinical skills, and then in year 2 it's much more applied with simulated skills for practice, so that students are prepared for their clinical placements. However, we've also got a greater emphasis on public health and social sciences and on professionalism, ethics, leadership and communication, so that we can build those skills that these students will need when they go out in practice. We know very much how much lifestyle is affecting disease, particularly in the Northwest, or even more in the Northwest, contributing to those health inequalities. But we also know to engage students in public health, we have to make it relevant to medicine. So we're not just preaching about public health, we're actually developing the skills of the students to understand what the health problems are in their community, to develop skills in brief interventions, motivational interviewing skills, so that they can support and advise their students, but also their patients, but also understand the constraints that the patients have, so that they're understanding and they can communicate appropriately. We also know that professionalism is a major issue in graduates and doctors in training. So there is a huge emphasis on students understanding what professional behaviours are, and we expect them from year 1, not just from when students go on to placement. Students are also given early clinical experiences on year 1. In year 1, that's community based, so they go out. I know some have already been out with some of your midwives, and then in year 2 they have week-long placements in medicine, surgery, primary care and mental health. So there is an increased emphasis on placements within primary care in mental health in phase 2. This is because we know these are shortage specialties, but there's also an incredible amount of learning that can occur in primary care and in mental health that is important for doctors in training, no matter what specialty the students decide to go into. The focus on clinical learning within the placements, but we have that emphasis on the year themes. And we know that we want doctors who can work within multidisciplinary teams. We want doctors who understand the patient journey, understand the issues of people with chronic long-term conditions. So that's why things are, the curriculum is developed in the way that it has. Students come back for 4 to 5 weeks consolidation during their clinical placements, where we want to underpin their placement experiences with refreshing their academic learning, so that they can understand what's happened on placement, why it's happened, and what strategies they can develop to support their development as doctors. Our assessments are the same as other medical schools, although the emphasis may be slightly different. So they have a written examination, OSCEs in year 2 to year 5. They have a professionalism assessment, which takes into account not just things like their DOPS and the assessment of clinical competence, but also their attitudes, their values, their engagement with those things that we have to engage with when we're looking at our professional, when we have our appraisals. Research, they will undertake projects, but our emphasis again is on really what does a doctor coming out from practice need to understand about research, understand about using research evidence and also developing services. So there's very much a focus on looking at clinical guidelines, looking at evidence, understanding evidence, developing skills in clinical audit across the 5 years. Just to highlight that we will be taking part in the medical licensing assessment in our final year, and our final year students, our first cohort of students in their final year will be amongst the first undertaking the medical licensing assessment. So that's an applied knowledge test and OSCE, but with GMC oversight as to those tests. So where are we up to? As Claire said, we've taken our first year of year 1. This is our second year of our foundation year. We've got 31 students this year, mainly due to some of the issues that happened with A-levels last year. We're slightly over. Our 17 students from our foundation year last year have all progressed into year 1, and we've got 14 direct entry students. They are very engaged students. They have really impressed us with their enthusiasm, their engagement, their clarity of thinking, and we haven't noticed any difference really between our foundation year students and our direct entry students. They seem to be very similar in their achievements to date. So, you know, this gives us a little bit of an opportunity to say, you know, if you want to come and work with us, you know, we have opportunities as career champions, the teaching sessions, involvement in our question, and when we get to OSCE station writing, our standard setting, as OSCE assessors, and also as MMI assessors to help us with selection of students. I just didn't want to forget that we also have our Physician Associate Studies students. You'll know about Physician Associates and their role in support of doctors. It's a 2-year programme. We've got our first cohort graduating this year, and we know that they have placements at Southport and Ormskirk, and we thank you for all your support in that. And just to remind you, over the next year, the Physician Associates will come under GMC regulation. So there's quite a bit of work that we need to do in order to make sure that we meet that. However, we feel we're quite a way along because a lot of the processes that we've developed for the medical school are also appropriate for our Physicians Associates, and they're already participating in those. So just the issue to emphasise about the issue about widening participation. You know, these are students who academically are very good, but may not have had the same academic support within their schools as others had achieved. They are actually got a lot of life experiences and life skills that have been really important in their engagement to date with the programme. One of our students was a case study within the Times, and I think it's just important to note, you know, that they do feel outsiders, and we need to support them not just across the programme, but also as they get out into practice. They haven't had the same support structures and networks as other students. So we just need to be mindful of that. If you've got time, there is a little YouTube video there of one of our students speaking about her experience. So, you know, if you've got time. Another little bit of advert. We have a training and development spring conference on the 11th of May. This is mainly going to be access to online presentations, but there are 3 live stream sessions. I can forward to Anne the flyer for that so that she can send it through. But if you're interested, please feel free to get in touch with us, both about the spring conference or if there's anything that you would like to become involved in. and just some contacts, my contact, and then contacts of some of the key staff, key leads within the school. That's it.
Hello, thanks. I'll just open up for questions. I'll send you over. Dr. Holden, can you hear me?
Yep.
So if perhaps if you leave your mic on, you could answer any questions that we get.
Yeah.
Oh no, that's the wrong one that I'm moving.
So I'd just like to say thank you very much for that. I probably should have said at the beginning, shouldn't I? I'm actually an alumni of Edgehill. I did my PG cert with you guys. I'm also a career champion. So I'm the career champion for intensive care medicine, but I'm not surprised that nobody in their first year at medical school is currently yet aspiring to be an intensive care doctor. So I haven't had any inquiries from that as of yet. Obviously, you mentioned the GMC process. I'm aware of some of the things that you had, or the hoops and the hurdles that you had to jump in order to do it, but perhaps some of my colleagues perhaps aren't. Do you want to just give us a flavour perhaps of what you needed to go through? Could we put the back live, please, Zoe?
Yep.
There we go.
Yeah, so there are a number of areas that the GMC want to demonstrate, us to demonstrate that we can achieve, pretty much similar to the ones for postgraduate training. And we have to demonstrate that we can achieve all those. So we have to develop processes, very robust processes around things like raising concerns, fitness to practice, around educational governance with our placements, assessment. So we have we have to go through both issues. So for example, for the written assessment, we have to develop a question bank. We have to standard set all those questions, both develop the questions, but also standard set them prior to exams, and then go through a series of analyses afterwards to ensure that we're fair to the students, but we're also identifying the level of competence for us to set the mark that will ensure that will state that students have passed or not. We have to I can't remember all the things. There were so many things we had to do. Staffing. So we've had to demonstrate that we've got the staffing, we've got our placements, placement agreements, demonstrate we've got sufficient resources, and we have got a brilliant new clinical skills building if anybody ever wants to come and see it, particularly once COVID is at a level that we don't have to socially distance so much. We feel that we have done extremely well to get through all these processes. It's been a hard job. We will now, the GMC will come back to us now every 6 months to check that we are doing what we said we are doing. They will speak to the students, so this, and they also are asking to speak to our placement providers at the meetings. They'll observe our assessment processes, and we're doing that alongside delivering the first year, and obviously supporting the students along the way, and selecting our next cohort students. So it's quite an intense, been a very intense, what, 2.5 years, 3 years. But we're also extremely grateful that we've had a lot of support from our clinical colleagues and our providers, and a lot of engagement.
Thank you. Somebody, Zoe, can people hear me? Can you hear me, Paola?
Yeah.
Okay. Somebody wants to know, is there any way that you can ensure the students will stay within the region once they finish the course?
There's no way that we can guarantee that. However, a lot of the students come from the area. That's part of the reason to recruit from the area, because we know that many students who come from an area will stay in that area. We demonstrate how good medicine is in the local area and what the opportunities are as we move forward. Then we will be able to support these students to remain in the area. But there's no guarantee, but we will demonstrate to them how good it is in the Northwest. I'm a Londoner and I know how good it is in the Northwest. I've stayed up here.
Well, I never left, much to my husband's disgust. I basically moved 30 miles. So I was born in Preston, went to university in Liverpool and then went back to Preston. My husband, who's not a doctor, who was hoping to travel the world on my behalf with me, is naffed off that all we've done is a 60-mile round trip. So I think that does demonstrate the thing. I think what potentially will fit into potentially keeping these students certainly close to us and hopefully in the Northwest, as part of the expansion that occurred in medical schools, there's going to have to be an expansion within foundation programme posts for doctors when they qualify, which we're expecting in the next couple of years as the increasing numbers from medical schools start to work their way out to qualify. One of the things that the foundation programme, certainly in the Northwest, has been very clear about, any additional foundation posts that will be created will be what they call longitudinal integrated training. So that will be basically primary and secondary care simultaneously occurring. So rather than people doing discrete placements in community placements such as psychiatry or general practice for a fixed period of time and then a period in a hospital specialty, actually these training programs will actually be running simultaneously, which will not be that dissimilar to the program that you have for your undergraduate students. So I think the other thing that is also actually interestingly changing is the way that general practice training is going to be changing in the next couple of years. And again, that's moving to a much more longitudinal integrated model. And there's certainly going to be far more emphasis on mental health. So I think some of the way that the postgraduate programs are having to adapt to accommodate the learning needs of our health population will fit very nicely, if you like, as almost a continuum with the way that you are developing your medical school program. And as an individual who will need these doctors to look after me, I'm hoping that they will stay in the Northwest in the way of some of these things that have happened. I've had one or two people saying they're very looking forward to welcoming the students from Edgehill, so that's good. At this moment, I don't think there's any additional questions. Thank you very much for your time. It's been really, really useful and really informative.
And thank you for giving us the opportunity.
Yes, thank you.
Yeah.
Okay.
Thank you. We'll end the live presentation now. It is available as a recording. Thanks very much. Bye-bye.
Bye-bye.
Bye.
Thanks, Anne.